how much doctors earn in Germany. If you are a doctor who is considering coming to Germany, or you're somebody who is just simply curious and you want to know, then stick around until the end of the video to get the whole picture. I figured that it could be one of those videos which could help you make an informed decision of whether you actually want to move to Germany as a medical doctor or you don't want to move here. My name is Melk. I'm a medical doctor. I live in Germany for the past 2 years, although I came originally from Uganda. After the recognition process, you are somebody whom they call an Assistenzarzt. Assistenzarzt basically means medical resident, and at this level, of course, you work under supervision. You're not allowed to open up your own clinic or do other things. The first year of working will be about 4,500 euros to about 500 euros, and that will be, of course, gross, and then the net will come in about 3,200 euros per month, and that will be the net that you'll be taking home. Each year, of course, the salary increases. By your 5th year or 6th year of residence, your salary has gone up. You are earning about 5,800 euros to 6,000 euros. And of course, the net you take home is always dependent on how much is taken off from you in terms of taxes. So Germany has quite a complicated system of taxes. We have class 1 to class 6. In class 1, usually it's for single people, and then class 2 has its own categories. Class 3 is for people who are married. Class 4 and 5, and anyway, 6 is kind of like the hardest. Yes, so if you're married in Germany, you're taxed less. If you are single, you're taxed more. I don't know why the system is against people who are not married, but of course when you're married you're taxed less, and if you have children you're also taxed less, so you go in a different class altogether. Somebody who's coming from the global south, if you've been working, like for example when I was in Uganda, that's pretty some amount of money. It's enough money to make you have a comfortable living. I mean, you'll afford a good house, you'll afford a good car, you'll basically be comfortable. If you're somebody who is actually looking into even earning more money and feel like you want more money, you can consider doing extra shifts at the hospital or doing weekend, maybe on weekends or public holidays. These shifts are always available. Although in Germany, you're not allowed to work beyond a specific amount of hours because of labor laws. They don't want you to work and drop dead at work. After about 5 or 6 years, depending on how long the residency is, you become somebody whom they call a Facharzt, and that means you are a medical specialist. That's like the second level of qualification. At this level, you're now independent. You can open up your praxis or the so-called clinic if you want to, for example, be a general doctor, or if you want to still continue working in hospital, you can still work in hospital. The advantage is that now you work with more independency, but of course it comes with more money. You start earning a bit of more money. And so how much to actually Fachärzte earn? How much to specialists earn? It ranges from 6,800 to about 8,000 or 9,000. That's like the broad range. So it depends on the region of the country, the hospital, and the specialty that you are in. All those are factors that come into play. But insgesamt, or in total, when you come up with actually how much net, the so-called netto, that the German Facharzt takes home, it ranges from about 5,000 to 6,000 euros. If you also do extra shifts, they are usually more pay. And of course, extra shifts for Fachärzte are paid more than Assistenzärzte. So when you become a Facharzt, you're going to go into more training. That's if you want to go into more training, a bit of more experience within the German system. That would make you become somebody whom we call a senior consultant in English, but in German, they are called Oberarzt. These are heads of department. They also head units of hospitals, particular units of hospitals. And of course, that comes with more incentive. Now, the caveat here is that it actually takes pretty long for you to become a senior doctor in German. It will take about 10 years, from 8 to 10 years, yes, of simply learning and, being under the supervision and the training and learning more and, being under mentorship of different doctors. But ultimately, it will take you about 8 years for you to turn into an Oberarzt. How much do Oberärzte earn? When I say Ärzte, by the way, it's like the plural form of doctor. So these guys take home a whooping 8,000 to about 10,000 per month. I mean euros, and that's in gross. These guys will take home about 6,000 to 7,000 euros per month, and that will be in net, which is pretty a good deal. Now you have money, you have more flexibility, but the problem is that now you are given more responsibility at the hospital. You have to take care of more business. You're not as free as the Fachärzte. The top of the hierarchy of the hospitals in Germany is somebody who is called a Chefarzt. Now here you are the head. Now Chefarzt, like head departments, for example, if internal medicine or innere medicine, they'll be the head of that. And then Oberärzte will be like heading a particular ward or heading a particular unit, but a Chefarzt heads a whole department altogether. So these guys also earn pretty good amount of money. How much they earn? So the starting gross salary is about 10,000, but it stretches to even 30,000 per month, depending on the hospital, depending on the responsibility, depending on the unit in which you are. If you are a neurosurgeon or a heart surgeon or whatever, you'll earn more because they also bring in more money when they have done the procedures. Now, some of the advantages which come with being a Chefarzt is that you have things like the salary, you have bonuses in hospital, private patient billing, and then in some aspects you actually have profit sharing with the hospitals. So if you do a procedure and then you earn some money on that, you get it. It's a good deal. Of course, there is a price to pay. By the time you get on top there, you have taken some time under supervision and learning and gathering all this experience. But once you get on top there, it is worth it because yes, the gold is quite there. So some of the highest paying specialties in Germany simply include ophthalmology, which is in number 5. Then dermatology is in number 4. Cardiology is in number 3. Orthopedic surgery is number 2. And radiology is number 1. So radiology is quite competitive here. If you're a radiologist, yes, it's a good deal. Then you are making some good amount of money. Why are these specialties actually expensive is because there is a lot of possibility of having high volumes of patients, but also they use quite expensive equipment in their treatment of patients. If you are somebody who is looking into earning money and maybe you feel like you want to take this direction, yes, the first thing you have to pay attention to is choose a high paying or a very profitable specialty that you want to go and do as residency here in Germany. And then you might consider working in rural areas, because if you work in rural areas, you actually get to earn some more money. There are some bonuses which come with somebody being in a rural area. And then simply learn how the systems work, learn how the billing systems work in hospitals, and yes, you will be able to take home quite a good amount of money. But all in all, medicine in Germany, just like in many other countries, is one of those respected professions. Every time you walk into a person and you're like, by the way, I'm a doctor, they'll be like, du bist Arzt. So it's quite a respected profession world over. It has this prestige on it that sometimes it's even not just about the money, but the fact that you handle human life. That value is still carried on even in German. If you want to do medical residence in Germany and you don't know how, then you want to check out that video here, because in that video I go into detail on how you can apply for medical residence in Germany. Like the video, please, if you haven't already, and subscribe also if you haven't already. And I hope I'll see you in the next one. Bye and peace.